Good morning. Today we're going to be talking about malaria, which is actually a very important topic. Although a lot of people think they know all about malaria, it's still a major killer in our country today. The World Malaria Day will be taking place on the 25th of April, and it's very important that we talk about it. Thank you. We have a fantastic lineup of specialists today. We have Dr. Adesoye, we have Dr. Fola, and we have Dr. Ozuomba. So thank you very much for coming on the program.
Thank you very much.
Pleasure. Good morning.
If I can kick off with you, Dr. Adesoye. You are a public health physician. So can you just tell us, why is malaria so important? Why is it still a major killer in our country?
Thank you. Malaria is a preventable, curable, life-threatening ailment which causes significant monetary impact as well as significant ill health and mortality. And studies have shown that there are 263 million deaths as of 2023, 263 million cases of malaria occurred globally. And with this occurrence, we had 597,000 recorded deaths in 83 countries. Now, the WHO further reported that 94% of these figures were found in the WHO Africa region, and 95% of these figures also accounted for the deaths that malaria caused. Now, the age group that suffered significantly from this, the deaths and the illnesses, were 76% of children. Now, you're going to agree with me that that's very, very significant. Because if you have 7 out of 10 children dying within the population, then it's a cause for alarm. So that is why it's very important that we continue to raise awareness about the public health impact of this deadly but preventable or curable disease. Thank you.
Straight over to you, Dr. Zoe. The transition. Can you talk about the impact? What are the symptoms? You know, we have vulnerable groups that are particularly affected by malaria, pregnant women, and as Dr. Adesoye mentioned, children. Can you tell us a bit more about that?
Well, malaria, if anybody said that specific symptoms are attributed to malaria, that may not be correct. They share symptoms with other illnesses. But commonly, sufferers will present with fever, they present with chills, they present with body pains, some may vomit, some may have a loss of appetite, weakness, and all that. And we know that these are symptoms that are shared by other illnesses that are not malaria. So the presentation vary and can be severe, it can be uncomplicated as well. So that is how it comes. So it means that somebody will have a high index of suspicion and try to confirm, not just assume that what the person presenting is malaria. In our situation here, we know people coming to tell you that, doctor, I have malaria. One is likely going to miss it if you believe everything they tell you. It may not just be malaria. Somebody may be tired, may be stressed, may be fatigued from a lot of work, and we tell you that it's malaria.
And we're talking about the vulnerable groups, the special groups, pregnant women and children. They seem to be inordinately affected by malaria. Can you tell us more about that?
Yes, the thing is that pregnancy, yes, even though it's not a disease state, but you know there is some form of changes that happen that make the person vulnerable to infections. Malaria is not left out in this situation. And why it is so important in this age group is that you are dealing with two lives, the mother and unborn child. And this malaria can lead to a lot of things cause death in the mother, death in the child, lead to intrauterine growth restriction. It can lead to premature delivery. It can lead to fetal loss and all that. So, and for children, especially the under 5, I mean, because they still have, they have not developed quite appreciable immunity, they are also quite vulnerable. And severe form of malaria is not uncommon in this age group. You know, the issue of febrile convulsion and all that, including acute kidney injury, can also happen in this age group. So it makes it quite important that this age group is actually looked at seriously when it comes to malaria.
No, you're very correct. And I think the statistics that Dr. Adesoye spoke about are extremely distressing. And it's something that, is also very worrying, because with the removal of, specific, the funding that to some of these conditions from that has happened recently, it is very worrying to know that these things may be, the incidents can be made worse by this. If I can just jump over to Dr. Folajimi. Dr. Folajimi, can you tell us, Dr. Fola, about the diagnosis? How do we make a diagnosis of malaria normally? And are there any special things you want to tell us about in terms of how we can pick up issues with malaria?
Okay, thank you very much. To be able to diagnose malaria, one has to go to a hospital or a laboratory, and then the blood sample will be taken. The first way, which is basically the gold standard, is to put the sample of a blood under a microscope and visually inspect it to see the Plasmodium parasites in the blood film. Another way that is becoming more popular is the use of rapid diagnostic testing, and it is making it easy for people to do malaria testing, not just in the hospital, not just in the laboratory, but also in the community. This is another method which is getting more popular, where you can actually test a child or an adult in a very basic way with minimal training, and then one can also determine if the person has malaria or not. It's important that testing has to be done, because malaria symptoms overlap with so many other diseases. And a lot of time, people feel that they have malaria when they do not have malaria. And people keep arguing that they know their body. But the importance of testing cannot be overemphasized over time. So it's either we are doing it via the MP film under the microscope, or we are using the rapid diagnostic testing. Those are the popular, very specific ways of diagnosing malaria.
Thank you. And I know that we haven't yet spoken about complications, but there are lots of complications to malaria. Can you tell us a bit about complications of malaria and the special tests that you've developed to help us pick it up?
Okay, thank you very much. So, complicated malaria or severe malaria is actually the main problem when we talk about the mortality of malaria. It's because most people will have malaria and they recover. But the moment complications sets in, the chances of survival begin to diminish. And almost all mortality in malaria lies within complicated and severe malaria. Now, the most common complication we know is anemia, where the parasite destroys the red blood cell and the person falls short of having blood. However, there's a second complication called cerebral malaria, which is actually not the most common, but is the most lethal and the most severe, is the deadliest form of complication that can occur. And it's responsible for almost half of the mortalities from malaria. One of the ways we've developed recently in order to enhance this thing is this. We've been able to look at a specific biomarker in the eye, which everyone knows as malaria retinopathy, and use it to accurately diagnose cerebral malaria. Before now, the challenge with this diagnosis is this. Because of the endemic nature of malaria, a child can present sick at the children's emergency, unconscious, and it is easily assumed that this child has cerebral malaria. But studies have shown that about 7 children out of 31 children post-mortem were discovered not to have cerebral malaria as earlier thought. So the clinical diagnosis has not been sufficient, and we are looking at ways to enhance it by making physicians or clinicians examine the retina at the bedside, identify if that child has malaria retinopathy, and use that to be very, very certain that this child we're dealing with, this unconscious child, because they usually present unconscious, is actually having cerebral malaria. We've been able to use this together with artificial intelligence, so there will be no human error of, oh, I saw the image, I don't know what is there or not.
Yeah.
We've been able to develop an AI subject in that regard, so that you don't need the visual inspection anymore. The AI, which has been trained with over 4,000 retinal images of malaria retinopathy, can identify all the particular distinguishing feature of malaria retinopathy. And we are going to use this to see how a child, when they arrive at the children emergency, can be diagnosed within the first hour, so that you can easily rule in or rule out the presence of cerebral malaria. And that is very important because this feature in the eye, the malaria retinopathy, is very pathognomonic, and it's also prognostic, in the sense that if it's so much that you know that the chances of that child's survival is very limited, and you can then triage properly and step up supportive treatment that is needed. And because when we talk about severe malaria, the challenges we have are no longer about anti-malaria. We need to manage those complications carefully. In the case of anemia, the child will require blood transfusion. In the case of cerebral malaria, the child is unconscious and will require supportive therapy. And sometimes you might even find signs of papilloedema in the eye, which is an indication of cerebral malaria, cerebral edema.
Yes.
And you may have to attend to that also. So we're looking to make sure that less children die from this complication. And because we have a resource poor setting, the brain is not, being able to have an idea of what's going on in the brain in the child is not a commonplace thing. But with what the retina will be showing us, because the retina and the brain embryologically share the same blood supply and microvasculature, you can have an idea, clinician can have an idea of what's going on in the brain and use that as an indicator to treat the child.
Thank you. Thank you very much. Dr. Ozuomba, can you tell us a bit about issues, related to malaria? Things like, are there any genetic traits that make one group of people more susceptible to malaria than another? And then again, in terms of the personal behavior patterns, what causes drug-resistant malaria? We know it's a problem. And is there anything that the individual does or doesn't do that makes this happen?
Well, the issue of susceptibility to malaria, we know that malaria is common among Africans in the tropics, and the whites are not protected from it. So when they come here, they even have the severest form of malaria because they don't have any protection whatsoever. So for us in the tropics, because we have been exposed to the bites and all that, our body develops some form of immunity, and we have some level of protection. Now, in terms of genotype, it is said that people that have AS, don't have malaria or severe form of malaria as much as people that are AA. But even though that is not 100% correct, because I, for one, I am AS, and I know I have malaria often as much as. So some people have, used that and thought that they are AA when they are AS.
Okay.
And again, the way we look at malaria, some people you have any form of fever, headache, and all that. This is malaria. I'm feeling weak. This is malaria. You go and start the medication. And oftentimes they don't complete the medications. So by the time you stop it halfway, you are actually helping the malaria parasite to develop some form of resistance to the drugs you are taking. And these drugs are easily available over the counter. Anybody can walk into any place to go and buy it. And they don't complete the dosages. So that helps to create resistance. And
that is very dangerous.
Yes, it is
for
dangerous.
all of us.
Yes, and it is something needs to be done about. Again, like when we were in school, the pattern was that once you have fever, headache, body pain, it is malaria until proven otherwise, because it is a common thing among us. That also helped in the mistreatment of malaria and creation of the drug-resistant strains that we have everywhere. But now, the ideal thing now to do that is being promoted is that whether you have anything, do microscopic diagnosis, or you do RDT to confirm that it's malaria before you treat.
Yes, that is absolutely critical. Thank you so much. If I can jump quickly to Dr. Adesoye, unfortunately, we don't have much time. Now, talking about prevention, obviously, it's very critical. We need to make sure we don't create any more drug-resistant strains, but how do we prevent ourselves from getting malaria in the first place? What are the new things that are available now that people need to be aware of, that people can have to prevent malaria?
Okay, in the prevention of malaria, it's widely advocated that people should sleep under long-lasting insecticide-treated nets. And this is a program that the federal government and state governments and NGOs counterparts really invest in. So the targeted individuals are usually the pregnant women. And then when they come for their antenatal care visits, they are given these nets.
Okay.
Because it's expected that these are the mothers who are closer to the children. I recall from the opening statement I made that children are most impacted by, particularly children under 5, are particularly most impacted by malaria. So we have the use of insecticide-treated nets. Then we could also have an indoor residual spraying, which could last 3 to 6 months, which prevents...
Can I ask, apart from that, I know I don't want to jump in and all that, but what about malaria vaccines?
Okay.
We've heard so much about malaria vaccines. Are they real? Are they here? Are they available? What can we do about it? How useful is it going to be for us?
Okay. Malaria vaccines are real. And last year, the government rolled out some administrations to children in 2 pilot states, namely Bayelsa State in the south and Kebbi in the north. And about over 100,000 vaccines were used. And this is because these areas were sites identified as high endemic zones. They have a high transmission all year round. So
and
these
did it
were
work?
pilot states. Yes, it did. It did.
So when are we going to get more? I know I'm rushing you, but unfortunately, we've actually run out of time.
Yeah.
When are we going to get more vaccines? Because if we have vaccines that can stop this and prevent our children from dying, these are the things that we need to have rolled out. What's the government doing about it?
Okay.
What are the communities doing about it?
I'm very certain that because of the successes that have been recorded, the government is already making plans to get more of these vaccines and then widen the scope in terms of distribution of these vaccines to the states in Nigeria.
And are we finding good reception by the communities for this vaccine?
Well, that will be a continued conversation because, normally when vaccines are introduced into communities, people are usually skeptical. And we know that many factors are very involved: individual factors, household factors, health system factors, community factors, particularly because people may have wrong notions about government trying to, decimate the population. And this is very expected because of the high trust deficits between government and the people. So it's continued conversation and engagement, particularly with the media, to enlighten people on the need to embrace the vaccines that are being rolled out.
Thank you. So if we can have some last words from our listeners. Dr. Folajimi or Dr. Ozuomba, would you like to go next?
And what?
The last words for our listeners.
Okay,
Well,
one thing I would like to mention is around the area of prevention. And I have this quote I usually use for a while back, and it goes like this, that malaria is not just a medical disease, it is also the consequence of an environmental failure. And what it looks at is this: the area of larval source management is something that we need to develop and look into, even as a people and as a community. We need to eliminate breeding grounds around us. I think that's a primary way to stop the problem. And that's what I want the listeners to understand, that sometimes these mosquitoes in our area, there are consequences of our actions, and we need to take responsibility and make changes in that direction.
Thank you. I think that's very critical. Dr. Ozuomba.
Yes. What I will say is to tell the people that because malaria is with us, every fever, every weakness is not malaria. Don't go and start buying medication without properly being diagnosed of having malaria. That is what I would tell them, so that we don't create resistant strains. We started from quinine to chloroquine. Eventually, we now jettison them because of the resistance we have created due to our habit of treating when we are not sure that we have malaria.
Thank you. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.